One of the things that we were interested in a phase 2 trial that we performed was whether peripheral blood testing may be able to give us some sign of prognosis, can be prognostic compared to the bone marrow. And traditionally, what we've known is that patients who have bone marrow results, they're typically on the NGS side much more sensitive than the peripheral blood by about a log of 2 in many cases. And so what we were interested in here was looking at a specific time point, the cycle 4 time point after patients had received Elo-KRd. This was a non-transplant study. So patients got Elo-KRd for 12 cycles, and then there was MRD-guided discontinuation of Carfilzomib, leading to the maintenance portion. So 46 patients were, enrolled in this study. We had IMWG response criteria available for 42 patients at cycle 4. In other words, these were patients that hadn't left the study or hadn't progressed by that point. We also had 34 patients who had bone marrow MRD status by NGS at cycle 4, and we had 31 patients who had peripheral blood MRD by NGS available at cycle 4. And with a median follow-up now of 45 months on the study, so this is pretty mature data, we had 13 progressions and 11 deaths, 9 of which were from progression. The 4-year progression-free survival on this study with Elo-KRd was 73%. When you stratify PFS by the rate by the achievement of a complete response at cycle 4, there's these PFS curves look identical. There is no difference between patients who achieved a CR versus those who were less than a CR. But when you look at PFS by achievement of MRD negativity by NGS at 10 to the minus 5 in the bone marrow, you can see, which is not surprising, there is a clear distinction of these curves that the PFS is superior for patients who have achieved bone marrow MRD negativity. But actually, we see the same thing for patients who achieve peripheral blood MRD negativity versus MRD positivity. We actually see that these curves are even more profoundly divergent. What's really interesting is that overall survival in our study is also can be predicted to some extent by MRD negativity in the peripheral blood, same as in the bone marrow, but it's particularly significant for those who achieved peripheral blood MRD negativity. So what this tells us is that we can actually do peripheral blood MRD NGS at cycle 4, and that can tell us sort of what's going to happen to that patient to some extent. And I think this has broad applications because what it may mean for us in the future is that if we see this after 4 cycles, maybe this is a reason to tell us someone should go to transplant, someone should have intensification of therapy. You know, the other side of it is that maybe this is just a reflection of people who have circulating tumor DNA or people who have circulating plasma cells. If we see that even at cycle 4, that's a very bad sign for the patient. We already know that circulating tumor DNA related to myeloma or circulating tumor cells at diagnosis is associated with worse prognosis. So maybe this just shifts it a little bit further to the cycle 4 time point. We also looked at matched peripheral blood and bone marrow samples and found that there is a very high correlation between these two when you look at NGS. And the median log difference in terms of detecting myeloma cells is about 1.38. So this is sort of validating what we've seen in vitro studies, that we know that peripheral blood is less sensitive than the bone marrow. But this is, I think has broad applications for what we might be able to forego a bone marrow biopsy for some patients early on in treatment.